Thank you so much for being here with us today to talk about some legislation that's being introduced in both the House and Senate today as a follow-up to the rape insurance legislation that was passed by this legislature and took effect very recently. Many of us who voted against that legislation told stories of people that we knew who had very medically necessary procedures that would not be covered by insurance without the purchase of a separate rider at that time. We also told stories about the states that had passed this legislation before, and what we saw was many of the insurance policies in those states didn't offer a rider for sale. So what we're talking about today is something many of us predicted would be the case. I've had OBGYNs from my district start to tell horror stories from the emergency room and from their doctor's offices of women who had wanted pregnancies, where something goes wrong, where a miscarriage needs to be finished, and now women are finding out that their insurance will not cover expensive hospital stays, and these women can't even purchase a rider. Only 7 of the 42 health plans in the state offer such a rider for sale. The legislation that Representative Roberts and I are introducing today would mandate that insurance companies provide that rider for sale. Now let's be clear. When this legislation passed, Senator Whitmer and myself, some others in the Senate, introduced legislation to repeal it. We believe the rape insurance law should go, but that has been sitting in an insurance committee. It's not even gotten a hearing. So what we want to make sure is if that bill doesn't get a hearing, if that legislation doesn't get repealed, that at least we're sending the signal that women's vital, necessary health care should be available and those riders should be available for purchase. Thank you.
Hi, I'm Pam Faris, State Representative out of Genesee County, and thank you, Senator Warren. I'm happy to introduce this legislation on the House side, which really brings us a little closer to where we need to be for women's health care in Michigan. Last December, the state did a terrible disservice to women when the legislature passed the Abortion Rider Initiative, and instead of letting it go to the voters of the state to decide the outcome, the House and Senate chose to vote on it themselves. For ourselves. In their rush to pass the initiative before the deadline, Republicans passed a law that stated women would need to buy an extra insurance policy rider just to get important health care coverage. Like Senator Warren and Representative Roberts, I still oppose this law and would like to see it repealed. Our bills would allow women and their families to purchase coverage so that they and their daughters have vital health care insurance during the time of a miscarriage or to help women regain control of their life after a devastating crime. Currently, women needed to have this insurance rider to protect our health without facing high out-of-pocket cost and risking bankruptcy with our families. But we never told insurance companies that they had to sell it. So as a result, many women around the state who want to safeguard their health and buy this policy just simply can't. It's not a matter of not wanting it, it's a matter of it not being sold. Of the 42 health care insurances in the state of Michigan, only 7 offer the policy. And the companies that do offer it only make it available as an add-on to an employer-offered health care plan. I think everyone in here has flown before, and we have all seen demonstrations on an oxygen mask or opening the emergency doors and the importance of a life jacket in certain emergencies on a plane. Well, the best analogy that I can give you would be the FAA telling airlines that they no longer had to provide life jackets for female passengers only. Airlines could grudgingly tell women that they'll allow them to buy a life jacket at the same time that they purchase their airline ticket. And if you really do want a life jacket to protect you in case of an emergency landing, you better go find an airline that offers them because we're not required to do that, and so we don't. So in the event of an emergency landing in the ocean or some other body of water, women who did not expect to need a life jacket or could not afford one when they purchased their ticket will be left treading water, bobbing up and down in the waves, just trying to stay afloat. Now, I'm not sure if Republicans were being hasty in passing the women's health care rider without making sure this insurance was actually available, or worse if they were just being cruel and cynical. But for women, the results are the same. Many women across the state can't get the health care coverage they need. They just plain can't purchase the life jacket. So our bills fix that problem by simply requiring that healthcare insurers make this policy available to all their subscribers. If our state can require women to buy this policy to get full health care coverage, then we can also require health insurers making it available to them. Now, I'd like to hand this over to Representative Sarah Roberts now for a few other comments. Sarah?
Thank you, Representative Faris. Again, I'm State Representative Sarah Roberts from the 18th District in Macomb County. And we just want to be clear. I mean, make no mistake. Our goal is to repeal this dangerous and unfair law so that women can make their own health care choices without the interference from those who believe women should not be able to make their own decisions. But until we achieve that, the very least that we can do is make sure that this option, this rider, is as accessible as possible. So we won't stop pushing back on repealing it. I was proud to introduce the repeal legislation with Democratic Leader Whitmer. And it's true, we've requested hearings, and it's been radio silence. So in the meantime, we want to make sure that all of the insurance companies are offering this rider. When we had this debate, I can say from the House floor, the Republicans kept saying, look, we're not denying women coverage or the ability to have a certain medical procedure. They're just going to have to buy it. All they have to do is buy the rider. And now we're seeing circumstances where women can't just buy the rider, because not only are only 7 out of 42 offering it, but individuals purchasing insurance plans, it's not available. And these bills fix that. So women all over Michigan are speaking out and taking action. A coalition of organizations and individuals have launched an online petition, RestoreMyCare.com, RestoreMyCare.com, to help mobilize support for ensuring women have access to full reproductive health care choices. And this is an opportunity for even more women to get involved, to become more educated on these issues, and find out more ways that they can be involved in standing up for their own health care choices. And young women like Meredith Osborne and hundreds of others are not going to simply accept health care discrimination. And to speak to this is University of Michigan law student Meredith Osborne with Law Students for Reproductive Justice. Meredith, thank you for being here today.
Thank you. Thank you, Representative Roberts. My name is Meredith Osborne, and I am the co-chair of the Law Students for Reproductive Justice chapter at the University of Michigan Law School. Joining me today is Adele DePola and Sabrina Rewald, and they are members of the Law Students for Reproductive Justice organization in Michigan. The Law Students for Reproductive Justice represents hundreds of young attorneys and law students throughout Michigan alone. We believe that all people should be able to exercise their rights and access the resources they need to thrive. They get to decide whether, when, and how to have and parent children with dignity, free from discrimination, coercion, or violence. Right now, individual policyholders are unable to buy comprehensive coverage that covers medical emergencies during pregnancy, incest, or rape. For those who could buy the insurance rider, only 7 out of 42 insurance companies even offer it. As young professionals considering where we would like to begin our legal careers, we want to live in a state that is welcoming to young people and respects women. However, we currently live in a state where many elected officials continue to play keep away with our health care. Michigan's success rests on its ability to attract and retain young talent. For all men, women, and families, it is vital that we have access to the health care we need. Keeping young professionals and talent in Michigan means restoring full access to health care for women and families. Until the current law is repealed, this means insurance companies should offer a rider for abortion coverage in all health plans. Law students and young professionals throughout Michigan have many options of where to work after graduation. And in order to keep us in Michigan, our elected officials, employers, and insurance companies need to understand that health care matters to us. Because of this discriminatory and dangerous law, Michigan is placing itself at a disadvantage to other states. Michigan is a hostile environment for young people, and we're paying attention to that. Through the combined efforts of Law Students for Reproductive Justice chapters across the state, the University of Michigan LSRJ chapter plans to send over 1,000 letters from students to insurance companies and employers by the end of 2015. We hope that these letters will put insurance companies on notice that we want the health care insurance we purchase to provide us with the full spectrum of coverage that we need. This legislation and our letters encourage Michigan's growth and job market. It will welcome young professionals and families to keep us here for the long run. Complete coverage is good for Michigan businesses. Thank you.